Thanks, Vicky, and thanks everyone for joining us. And Vicky, perhaps you could put the slides up. So I'll just, as we start to talk. So welcome to the Health Focus event for Hampshire Hospitals. Last one of these we did in October of last year. And what did it feel like in October of last year? We kind of knew something was coming, but we probably didn't quite know how big it was. And then it hit us like a sting train, didn't it? And the reason we're doing the talk that we're doing now is for some really good people who work in our organisation, what's it like a year on from the start of the pandemic? So it's been a very pressured period for the trust, as I'm sure you would be aware. Our staff have been incredible during this period, frankly, and I know that Alex will touch on a lot of this in her presentation, but can I just say in front of all of you, a huge, great thank you to all of our staff who were absolutely magnificent through what would have been, for almost all of them, some of the worst periods of pressure that they've ever suffered in the NHS. They've been absolutely fantastic. Those people on the front line dealing with patients directly, and all those good people in support of them, wonderful. Thank you for everything that you did. So a quick look at the agenda. Alex is going to start the presentation about just a general update. Those of you who've been to these events before will recognise those. And then we've got Avneet, Sarah and Natalie, people who've been on the front line dealing with patients, just reflecting on what it was like for them. And I hope you find that inspiring in the way I hope you will when you see what they hear, what they've got to say. So lovely to see you all. Thanks for so many for joining us. And I'm going to hand you over to start with to Alex.
Thank you very much, Steve. And thank you to all of you for joining us on Zoom this evening. And it's really lovely to see some familiar faces and people who came to our Health Focus events in person and we maybe haven't seen quite so much of over the last year or so. So I'm just going to give you a bit of an update. As always, our mission is encompassed in these 4 strategic priorities about providing outstanding care for our patients, empowering our teams, living within our money and innovating for the future. And as always, underpinned by our values, our care values about compassion, accountability, respect and encouraging. And you know what? These have really stood the test of the last year in terms of how we conduct ourselves at Hampshire Hospitals and how we decide what to prioritise. We're using this framework in terms of the priorities for the year that we're currently in. We've just started our new year in April, and these are our areas of focus in the year 21-22. I'm not going to read out all of them, but you'll see that under outstanding care for our patients, delivering our COVID recovery plans is in there, and this evening has got a COVID theme to it. We are all really struck by not only the need to look after patients with COVID, who thankfully are few at the moment, but have been many, but also provide care for all of the other people in our population who need hospital services, a number of whom are now waiting a lot longer than they would have been if we hadn't been through the recent pandemic. So that's a real focus for us. In terms of empowering our teams, the health and well-being of our staff is our top priority in this quadrant. Our staff have been amazing, as Steve has said, have worked unbelievable hours, have seen things that you wouldn't want anyone to see, have provided unbelievable compassionate care to so many people, and we need to look after our colleagues and make sure that their own health and well-being is absolutely at the forefront of what we're doing. We've also got in empowering our teams a real focus on equality and diversity, and we've done a lot more on that in the last year in terms of inclusivity, but we want to focus on that even more in the year we're in at the moment. In terms of living within our money, we need to live within the resources available to us. We have quite an exciting capital plan in the year ahead, and we are going to deliver on that. And then innovation, I think you're going to hear a lot about innovation today from some of my colleagues, but absolutely delivering improvement and innovation plans. We have our new hospital programme as well, which is very exciting. I'll tell you a little bit more about that in a minute. And then we have a lot of transformation programmes, including around digital transformation. And digital has been one of the really exciting things that has come out of, or accelerated through COVID, I should say. Plans that we had thought would take us years sort of happened in weeks. So that's our plan for this year. As always, we start with the people that we care for who live in this geography inside this line here. And I know many of you will be living within that, in that circle as well. Your governors, so we have a number of our governors on the call today. One of them is Vicky, who introduced the evening to us. She is one of our staff governors. These are our public governors, names and photographs so that you can identify them if you pass them in the street or if you hear from them. We are so indebted to our governors. They're volunteers who really help us to make sure that what we're doing at Hampshire Hospitals is what the people of Hampshire want us to be doing, hold us to account for, serving our population, serving our public, and we're very grateful to them. The next slide shows you some of the staff governors and patient champions, as well as stakeholder governors. You will see that we have staff governors for various different staff groups. We have patient champions for disabled people, for older people, and for young people. And for stakeholders, the County Council are an absolutely key partner with us. And Simon Jobson, who works at the University of Winchester, represents higher education. And we're very proud of our partnership with the University of Winchester. So just a little bit on COVID before I give you a summary slide for each of our 4 objectives. In terms of COVID, we are over 2,000 people who have come to stay at the hospital with COVID over the last year. We've had some amazing achievements. I'm not going to steal the thunder of the people who are to come, but we were the first lab in an acute hospital that could test for COVID-19 way back in March last year. And that meant we were able to test our patients and our staff much earlier than many other parts of the country. Since then, we've conducted over 53,000 COVID tests, and we're still innovating. This photograph you see at the bottom left is a lab in a van that went out to care homes to be able to provide tests in care homes. And we're currently a national pilot for saliva testing as well. So still innovating in our microbiology team. We've done over 250,000 telephone and virtual outpatient appointments. And I still have lots of people saying how much better it is than when they had to traipse up and find a parking space at the hospital. But we've also learnt about when it isn't the right thing to do and when actually you do need to see a clinician face to face. So I think we're absolutely clear that the future will be a mixed model, some things in person, some things virtually or over the telephone. And we can really provide better care by doing both. We've redeployed over 250 staff. These are just the ones that we kind of logged as redeployed, but so many of our teams kind of our colleagues dropped what they were doing and went to work in areas of high need. And you'll hear more about that from our colleagues later on. And throughout all of this, we kept providing urgent care and we kept providing cancer care. One of the things I'm very proud of is that we have continued to provide cancer treatments in line with the national targets in terms of the speed of access to cancer treatments. And that is testament to the amazing teams we have working in our cancer care services. These are some photographs of some of our wonderful colleagues during the COVID period in their PPE and caring for their patients. And I want to say a thank you to the way that colleagues looked after other colleagues. We've done a lot in the trust to try and make sure that there is support, emotional support, providing free meals, providing training. I'm delighted to say that our staff never ran out of PPE. We've always had enough PPE in our stores. The folk who work in stores were just incredible at making sure we always had enough PPE. But do you know what really makes the difference to people is their colleagues in their teams looking out for them. And we are so lucky with the teams we have that people have looked out for each other through these difficult times. So where are we now? Well, we have fewer than 10 patients with COVID-19 in our hospitals today. We've been in single figures for a little while now. And we are really shifting our focus to caring for those patients whose treatment was delayed. And they were, as I say, not our urgent patients, not our cancer patients, but patients who really, their lives are being impacted by the treatment they're waiting for. It won't be life-threatening, but it will definitely be life-impacting. And it's the hip replacements and the knee replacements and the cataracts and those sorts of things. We're really focusing on those. Visiting restrictions have been, I know, difficult for the public. We are looking at easing them. We have eased very slightly. We've always allowed visitors at end of life and for compassionate reasons. But as you will all understand, allowing unlimited visiting at a time of a pandemic wasn't the right thing to do. And we still have fairly stringent restrictions in place, but we are updating and reviewing on an ongoing basis. We expect that some of these measures are going to be in place for quite a long time. So we're looking and planning ahead. So I've just got one slide on each of our 4 areas. So under outstanding care, just as this is an update on the hospital, the CQC is our main measure for the quality of care. And I hope most of you know, but it may have escaped your notice because it happened in April last year in the middle of wave 1 of the pandemic. But the trust was rated as good by the CQC. That was an improvement on the previous rating. And we were rated as outstanding for the caring nature, the compassion shown by our staff. We're not stopping there. We want to improve. We want to build on the progress. But this is just one of the quotes from the inspectors who said that staff treated patients with compassion and kindness. And I don't think we can ask any more of our colleagues that they always treat their patients and one another with compassion and kindness. In terms of teams, my one slide on teams is that staff wellbeing. That is our key focus for us in the senior management team and the leadership team. So looking after our colleagues. There's a wonderful photo taken here of our internationally educated nurses arriving in the trust. It was taken pre-COVID, but we have brought in over 200 internationally educated nurses since October 2020. And when these wonderful people come and join us, we support them through the test that they have to pass in order to be allowed to practice as a registered nurse in the UK. And we support them with everything else as well. So the wonderful teams make sure they have somewhere to live, they have a bank account that they can open. We've even recently had some of our colleagues, when some of these folk arrived in the middle of winter, looking out winter coats for them because they hadn't arrived with winter coats. And I just think it's another example of how staff at Hampshire Hospital go above and beyond to make people feel welcome and look after people. In the staff survey this year, out of 10 possible areas, we'd improved in 7. 92% of our staff said they felt trusted to do their job, and we increased by 6 percentage points the number who would recommend Hampshire Hospitals as a place to work. I mean, I think in the middle of a pandemic, that is really positive. We know we've got more to do. We absolutely know that we are not there yet, and not everybody would recommend Hampshire Hospitals as a place to work, but we are moving in the right direction. In terms of living within our money, clearly as a publicly funded organisation, it's very important that we live within the resources that we are allocated. This slide goes back a few years and shows that we had problems in 2019-20. In 2020-21, so i.e. the year that's just finished, we haven't finalised the Q4 numbers yet, but we were in a very strange financial regime where the government funded our costs effectively. So actually we will be showing, I fully expect, a green box for Q4 as well, but it has been a strange year. And as we move back to a more traditional way of NHS financing, I don't think we'll ever go back to how it was in its entirety, but we will certainly go back to more constrained NHS finances, I fully expect. We will need to be making sure that we are providing the best value for money that we can while we continue to provide outstanding care. And then in terms of innovation and innovating for the future, I could have filled hundreds of slides on this, but where we are, some of the things to point out, our digital care programme has been phenomenal over the last 3 years, but last year in particular. The telephone and virtual appointments, as well as the use of an electronic patient record that allows all of the inpatient data to be captured on an electronic system rather than paper-based. And of course, the use of things like Teams and Zoom for meetings and for getting people together. We've opened the beautiful Countess of Brecknock Hospice in Andover. It is an absolutely stunning building, which is purpose-built hospice care with 10 individual bedrooms, all with ensuite bathrooms, all with French windows that open onto grass area. And we're using it as part of our inspiration around the Winchester Hospice that will open this year. We're very grateful to the fundraisers. Both of these have been funded by charitable fundraising, and we have an amazing number of people who support the hospitals in raising money through these charities, the Medical Fund, and a range of other charities, the Art Cancer Fund as well. Hampshire Together I'll come on to, that's the new hospital programme, and then lots of innovation through COVID. So in terms of Hampshire Together, which is the Modernising Our Hospitals and Health Services programme, this is the new hospital building programme that I am sure everyone on this call has heard about. If you haven't, the government has announced 40 new hospitals across England, and we are getting one in Hampshire, which is very exciting. The programme was announced in September 2019, and since then we've been working with clinicians in the hospital, with clinicians outside the hospital, with the public, with patient groups, with stakeholder organisations, with councils, to develop what the plans might look like. And we did a lot of engagement in the summer last year that I know many of you will have been part of. During August to November 2020, we pulled all that information together in order to develop some options. Those options have been tested and refined further with groups of clinicians and patients and other representatives, such that we are hoping by early summer this year, in the next few weeks, we will be ready to go out to public consultation. I think it's on the next slide. Yeah, Vicky. So summer 2021 public consultation. The consultation is led by the CCG, the Clinical Commissioning Group, but clearly those of us in the hospital are absolutely involved in that as well. That runs through the summer, and then by late 2021, we will be making decisions on which site we will use for the new hospital and which services will be run from the new hospital and which services will be run from existing buildings. There's also a real flavour through this of doing as much as we can close to people's homes, either digitally, in GPs' surgeries, in community settings, wherever. So it's not just about hospital services, it's much broader than that. So when we've got a decision and we know what location we're building in and which services are going to run from there, then we start the planning work through 21-22, the design work of designing what the build looks like, the building work, and we are hoping that we will be opening our new hospital in 2028. So there is still plenty of time to get involved and get engaged, and we would encourage everybody to have their say and to have input into what this new facility could look like over the next few years. So that is my summary of where we're at the hospital. There are a whole load of other things I could have talked about, but I'm sure if you are interested, you can ask questions. Vicky, I haven't been looking at the chat. Have we had lots of questions?
Thanks very much, Alex. So we've had one question that I know that Lara has started to reply to. So Lara, I don't know if you're happy to just chat through for everybody else. We've had a couple of questions about the technology that we use with our virtual outpatient appointments and how we make the decision as whether or not they're virtual or in person, and how we support our patients with that as well. Lara, I don't know if you're happy to pick that up.
Yes. Hi, everyone. I'm Chief Medical Officer. So we did back in March, we changed all appointments to be virtual, if at all possible. And we actually did about 90% virtually. Since then, we've learned that this doesn't suit every patient on every situation. So now we're doing about 30 to 40% virtually. And we have some really good software to make that work as effectively as possible. And we know it doesn't work for everyone. And in some situations, we listen to patients if they say they just can't do it. Having said that, as Alex said, some people really like it. There's no parking, there's not, taking lots of time off work. So it depends very much on both the clinical situation and the individual. But we, nationally, there is a real encouragement to achieve about 30% ongoing remote consultations. And we have seen big advantages.
Perfect, thank you, Lara. We've had a question here from Steve, who's asked, how will new immigration rules affect our ability to recruit internationally trained nurses? Either Alex or Julie Dawes, I don't know if you're happy to answer that one.
Julie, do you want to come in? I'm happy to.
Hello everybody, I'm Julie, Chief Nurse. So at the moment, we still believe we're able to recruit international nurses. There are a couple of countries that have gone into quarantine more recently, particularly India, which may affect us, and we're just working through at the moment. There is a possibility that we can, if we can find local accommodation, we can actually ask the nurses to quarantine more locally and still actually take them in. So we're just working through it, but at the moment we still foresee a supply of international recruitment.
Thank you very much, Julie. Alex, those are the only questions. I'm just going to give it 30 more seconds just in case anybody's furiously typing away.
Alex, there is a question here that's been sent directly to me. I'll just ask you the question. It says, I hear all people are asked to go to Andover for physio now. Is there any reason for this? I don't know who wants to pick that up.
I don't think everyone's being asked to go to Andover. I can see Lara shaking her head as well. So we had, one of the things I would say is during COVID, we did move a number of services around. So for example, a lot of our antenatal care we ran from Andover, and our cancer treatment we ran from Sarum Road, the hospital in Winchester. And both Andover and Sarum Road, we kept as what we refer to as cold sites, or non-COVID sites, in order to protect sort of potentially vulnerable groups. So we did do a fair bit of that particularly during the peaks and the waves. We have now moved our cancer services back to our hospital sites. More of them have moved up to Basingstoke, where we have the FIRS unit, which is quite a standalone unit. But we have moved some back to the Royal Hampshire in Winchester as well. So it may have been that somebody went to Andover for physio at some point, but we're certainly continuing to provide physio services in both Basingstoke, Winchester and Alton and Andover. So not all of our services are in Andover.
Thank you very much.
Alex, if I can just say to the person who sent me that direct message, I hope that's answered your question. If it hasn't, message me again and we can we'll sort that out. Yeah. There is also a follow-on, Vicky, sorry, just because I saw it come up from Steve. The question about international recruitment was about the immigration rules specifically, not just about restrictions on travel for foreign our international workforce. So would somebody like to comment on that?
Yeah, so our understanding, and these things can always change, is that the immigration rules won't have a negative impact on healthcare professionals and nurses in particular, that they are in the exempt categories that will allow us to continue to recruit nurses. That's our understanding currently. That doesn't mean it might not change, but yes, certainly that is what we understand at the moment.
Thank you very much. Paul Kelly, I see you've raised your hand. Would you like to come in?
Yeah, yes, good evening, everyone. Just a question about referral letters. Are they sent electronically from the GP? And does the GP now receive a response from the consultant electronically? Because I know in my day, it was always you had to scan the letter when it arrived back in practice. And just as a follow-up, is it possible for the patient to also be sent an email copy of what the referral, of what the consultant has said following your consultation?
Shall I take that, Alex?
Yeah, Lara, go for it.
So we do use an electronic referral system now that goes into an electronic triage system. And we moved to all the referrals going into this triage in COVID, so we could prioritise those that needed to be seen most urgently. So what happens if it's actually a referral, it will then be actioned by the consultant as to which clinic it needs to go in, and you will just receive an appointment. If, however, we think that just advice and guidance to the GP would be sufficient, and sometimes that is the case. So they may be asking a specific question about a medicine or a situation. Then we would make sure that you had a copy of the advice and the guidance. When we do see you in an appointment, we are trying to make sure that we are now collecting a way to communicate with everybody so that we can send you an electronic copy. Now, this is quite early in the rollout, and we're calling it the patient hub. And you'll be sent a link that's once only you click on, and it takes you to the letter. So as I say, it's not for every specialty yet, but we're trying to roll it out really quickly to reduce the amount of paper letters that are being sent. People can opt out of this and have letters. And we are trying to make sure that people have copies of letters that are sent about them.
Thank you very much, Lara. I'm just very conscious of time. I'm just going to send one more question Alex's way, and then we will move on to the first of our 3 speakers for the evening. So Sally has asked, what are the main things that we're doing to support staff who have obviously been through a lot in the last year, and have, you know, are quite tired and may have had quite difficult experiences over the last year?
So we've got a whole range of programs and options. We've got something called Thrive, which is about helping staff to thrive. What we recognise is that for different people, there are different things that are helpful. So we've got you know, psychological support and counselling support for people for whom that's helpful, both at an individual level, but also for teams, because sometimes actually a team meeting together to talk through their experiences and share that with some sort of psychological expertise to facilitate that is what's most helpful. We're also looking at, as I say, a lot of staff went to work in areas that were unfamiliar to them. Some of them absolutely loved it and want a career in that area. Others kind of were so delighted to get back to what they had always known. And others just thought, do you know what, it's made me think maybe differently about my career. So one of the things we're trying to do is make sure we've got career options available for people who have said, I had a really good experience, I want to keep pursuing that, or actually it's made me think twice about what I was doing and I want to maybe try something else. So for some people, restoration of themselves, recovery, will be about a different job, a different role, and we want to try and support them with that. We're also we've given everybody an extra day's annual leave as a Christmas present. So that was just to sort of have a day's annual leave, but please, we said it's for this year. So although it was a Christmas present, we said take it after April, when you can actually enjoy the meeting your friends and family that you may not have had a chance to see at Christmas. And we've got a wellbeing hub that has lots of other resources. You know, it has apps and it has kind of referrals to other things, and we're really open to suggestions. So that's the other thing, is saying to staff, what would make a difference to you? I have to confess that the free lunches we ran during the main peaks were incredible, and they weren't just lunches, they were evening meals and nighttime meals for staff working nights and weekends as well, and those sort of things went down particularly well. So we're trying to listen to staff all the time and say what would make a difference to you as an individual. Yeah.
Thank you very much. I'm aware that we do have a few other questions and raised hands, but I am just going to move us on for now, and there will be another Q&A session towards the end of the event. So if I could hand over to Dr. Shahi, who is our next speaker. Who I think might be on mute.
The first technical glitch of the night.
There we go. Over to you.
Good evening, everybody. My name's Dr. Avneet Shahi. I'm a Registrar Junior Doctor in Infectious Diseases and Microbiology, and I work here in Basingstoke in the Microbiology Department. I'm also the Chief Registrar at Basingstoke Hospital. An interesting brief this evening, and I hope you bear with me. I'm going to tell you about a few things that I'm really proud of, a few things we've been involved in the Microbiology Department, and then share some personal reflections with you all. So COVID 1 year on, and what a year it's been, and what a year to be an infectious diseases registrar. I have spent in the last year, I've both been on the wards looking after COVID patients, and I've also been working down here in the microbiology department, where we're at the heart of processing and innovating and reporting COVID tests, as well as doing our usual microbiology bug business. So I have both a clinical and a laboratory role, or the best of both worlds, as I like to call it. So I'd like to tell you a little bit about our department. We aren't as well known as, say, the paediatric department or the orthopedic department, and you'll find most microbiology departments in the bowels of the hospital. But I've got to say that we're at the heart of the diagnostics of infectious diseases. And of course, the main infectious disease over the last year has been COVID-19. As microbiologists, we are on call 24 hours a day for clinical advice, and our laboratories run 24 hours a day processing COVID results. Irrespective of what the rates of COVID might be in the local community, we run a 24-hour service. And briefly, if I had to say one word of how the last year has been, I'd say it's been a year of change. We've rapidly upscaled and changed our processes in an effort to fight against this virus. But we've got good form already here at HHFT at being adaptable. Alex Whitfield mentioned that something that we're really proud of is we were the first non-public health laboratory in the NHS to implement in-house PCR testing for SARS coronavirus. So whilst other trusts were struggling, not getting timely results, we were able to do that in-house, and that's made such a difference. And the speed at which we can get results has improved on and on. Other things that we're really proud of here, we've set up 2 completely new laboratories in addition to our main laboratory, and we call these laboratories the rapid labs for obvious reasons. They're quite fast. We've got one at Basingstoke and we've got one at Winchester, and Andover's workstream comes regularly into Basingstoke as well. As well as our lab in a van, which Alex mentioned, we've also got a trailer laboratory, so in another laboratory where we process staff tests. And one of the other things I'd just like to talk about is diagnostics. We validated the use of a novel diagnostic platform which reduced our time taken to turn around a test, so from 6 hours to 2 hours. And commensurate with that, in the face of an international shortage of swabs at one point, we also enabled and validated the use of saliva as a sample type. So some massive things to be proud of, and it makes me really proud as a registrar to be part of this department where we are so innovative. I've put some numbers on my slide in terms of the numbers of tests that we've done, a total test for about 81,000, 76,000-ish negative and positive of about 4,000. And if you bear in mind, that's our total work stream that comes through all our labs. So that's a bit about the lab. And I'd like to just talk a little bit about academia. And I think this is really important, and again, something that we should be really proud of over the last year. Our laboratory scientists and doctors have authored or contributed to 16 scientific papers in very prestigious, sort of internationally renowned journals. And we've also, at HHFT, we're a major contributor to a study understanding the transmission of SARS coronavirus and what we call the variants of concern. And the reason I mention academia and put it as a separate reflective thing on my slide is I think it's really important that academia persists when you've got a pandemic, because the only way out of this, in my opinion, is through science. And as well as the papers that we've contributed to, HHFT, we've been taking part in national clinical trials. And this isn't just something I'm proud of at HHFT, I'm proud of the NHS, and I'm proud of the United Kingdom, that we essentially, the UK contributed to 2 major treatments that are considered game changers internationally. And you may have heard our Prime Minister and our Chief Medical Officer, Professor Whitty, talking about these treatments on the news. And we took part in that at HHFT, and that's a massive accolade, because it is what we call a game changer. So I've talked a bit about the lab, and I've talked a bit about academia. And my last loop on my slide is a bit of personal reflection. I think this has been the hardest year of my career, and I think it's probably been the most challenging year for the NHS. It's been tragic and tiring, both personally and professionally. I moved out of my own family home for 6 months in the first wave to protect my family. You can't see it in the camera, but I also developed quite a lot of white hair this year, having never had white hair before. COVID not only intruding in my life professionally and from my academic life as well, it also intruded into my personal life. My father got COVID and he doesn't have a functioning immune system. So he was one of the people that was shielding during the pandemic. And obviously I'm brown, and Black and ethnic minority groups do slightly differently with COVID. So there was a lot of added anxiety. And I'm incredibly grateful to say that he's thankfully recovering, but it has been difficult, and it's felt like every sphere of my life has been invaded by this virus. But as hard as it's been, we make it through. The patients have been extraordinary, the teamwork, the dedication, the support from our hospital, the wellbeing hub has been absolutely amazing. And the commitment and the appetite to change. Everybody's been so adaptable. It's a real testament to to everyone, and particularly for me, junior doctors. I'm the chief registrar, and part of my role is looking after the junior doctors, and I've been so impressed by their adaptability. As well as the junior doctors, the lab has been a particular epicenter for me, as Alex talked about. Innovation and science is what has been coming out of our lab. We're constantly evaluating and evolving, because the virus changes and it evolves. And as the virus changes, we need to make sure that our tests are up to date and that we can pick up viral strains. So just as the virus is dynamic, we're dynamic too. We respond in real time. And I do believe that science is the thing that will prevent this virus from getting the better of us. I just want to briefly touch on, I often get asked, what do you tell people when they ask you about COVID? And I get this question a lot. I've got a big Indian family, so you can imagine I get this question quite a lot. And the first thing I would say is stay healthy in yourself, eat well, exercise, and not just your physical health, but your own mental well-being. And that's something that is so important, that this pandemic has shown how important your mental health is. I mean, what's helped me is Dolly Parton songs, especially the Jolene one, where she replaced the word Jolene with vaccine. And that became really catchy, and we all sang that quite a lot. So that's the first thing, look after your own health. The second thing is, do practice the government guidelines around social distancing and the importance of hand hygiene, washing your hands, face, space, ventilate. It's really important in curbing onward transmission of this virus. Another thing I'd just like to mention, because I'm not sure everybody's aware of it, and I've been telling my patients about it, is please don't forget that the government are offering free lateral flow tests, so you can test yourself twice a week. And Public Health England have issued a statement saying, you know, regular testing is an essential part of how we go forth, especially as restrictions ease. And this is because, as our health secretary tells us, that 1 in 3 people can have COVID without symptoms, and that's why it's important to regularly test. Now, these tests are free online, and they can be ordered to your home address. And if you're unable to order them online, your local pharmacies might be participating in the scheme, so do go and pick them up. It's 1 box per household. You don't have to pay for them, and you've got an additional tool of keeping safe in this pandemic. So I said, my first point was stay healthy. My second point is respecting government guidelines. The third thing I say is be kind, and I don't mean to say that to sound trite. I mean to say that I've not met a single person who's been untouched by this pandemic in any way, shape or form. Whether you yourself have COVID, whether you've been bereaved, whether you've struggled with your mental health, whether you felt lonely, whether your anxieties flared, whether you're a frontline clinician or a nurse or doctor or work in the hospital. This year has affected all of us, and I think it's really important that we all stay and be kind to each other. And my last point, before I get told to be quiet, is I do think that we should stay cautiously hopeful. And the title of the talk tonight was COVID a Year On. I mean, it's incredible what we know now that we didn't know a year ago. Our treatments have more understanding. And as I said, the UK is the world leader in 2 of these treatments in critical COVID. And at HHFD, we contributed to that. But there's other things that make me hopeful. We understand the virus as it changes. We've got vaccination, we've got public health measures. This is a disease, I heard it described as a disease that eats away at the social fabric of our lives. And whilst that's true, I wholly believe that we can get through this together. And I mean, the last 15 months have been unaccountable, but we're still here smiling. And I think that's really, really important. Thank you very much. That's all I have to say.
Lots of claps for Avneet there. Thank you so much. We're now going to ask Sarah Gold to join us. So Sarah is one of our clinical matrons, and from my understanding has about 18 different roles in the trust, which I'm sure she will walk you through.
Okay, so hi, good evening everyone. I'm Sarah Gold. I'm one of the surgical clinical matrons at the Royal Hampshire County Hospital. So as Vicky just said, I look after a few areas, namely the treatment centre, pre-op assessment, fracture clinic, oral surgery, and more recently the COVID screening service at the Royal Hampshire County. So I wanted to talk to you a little bit about how my service is and how I've been affected over the last year. So if we sort of go back to March last year, obviously all our elective services ceased at that point, and what we needed to do at that point is to send our priority cases to the independent sector. Our elective wards then became functioning wards for COVID patients or other patients that needed our care at the time. So what that meant is some of the function of the wards that I was looking after changed. So my day case unit became an acute surgical hub for the trust. The pre-assessment clinic needed to shut completely, and some of the other services I looked after had to sort of downscale significantly as well. Encompassing that was the redeployment of many of my staff. So some of my staff obviously went to the COVID wards, some of them went to ITU, some of them supported health for work, and some of them supported research as well. So my role as a matron changed as well to a certain extent. So we sort of moved to a 24-hour a day shift pattern so that we could make sure that we provided, senior nurse leadership on the floor on a day and night basis to help support our teams through the more difficult times. So one of my biggest challenges, I guess, was involved in the COVID screening. So COVID screening at HHFT started right back in February, and it started on the Basingstoke site. It started in a very small room off of ED, and at that point we were just screening symptomatic patients. That quickly sort of escalated, and they moved into the larger Lasham unit, and they started screening staff. And they also started up the staff wellbeing helpline as well. And during that initial peak, we were swabbing up to sort of 80 members of staff or their members of their household every day. And that included also, local nursing homes, care homes and community teams as well. At their busiest time, the helpline was actually receiving up to 10,000 calls per month, which is, a massive mountain, really, I suppose. And that got steadily better over the months, but the support that they gave over those times was tremendous. We staffed these areas using redeployed staff from areas that were closed, and also staff that couldn't work on the front line at that time as well. And when we started to think about restoring our services, around about sort of June time, we identified the need to expand our services and also to move a swabbing site to Winchester as well. So COVID screening, I guess how it's going now. I love this picture. I remember that day very well. I'd forgotten my thermals and it was a very cold day. So we've now got two large drive-through services, both at Basingstoke and at Winchester. We operate 7 days per week, including bank holidays. And across both sites, we have capacity for around about 300 swabs per day. We still offer really easy access for COVID screening for our staff and their families and their households as well. And as has already been mentioned, we also offer the rapid testing as well, which the microbiology team have revolutionised, and we can get swabs back in as quick as I think 2 hours, which is phenomenal. So when we came to restoring our services, so our priority elective surgeries actually recommenced at HHFT at the end of April, start of May last year. And then we moved on to other routine elective surgeries, restarting in the July. During this time, we did really well. We achieved and actually exceeded some of the goals that were set for us for elective restoration. And I think since August last year up until this time now, including our endoscopy service, we've actually had 18,000 patients through our services, which is quite phenomenal. One of my other responsibilities is I had to try and plan and facilitate a safe ward environment by creating a super green elective ward. And what super green basically means, it's a protected area that allows us to admit our elective patients. We don't admit emergency patients into that area, and all patients have been screened and self-isolated before they're able to be admitted. So it's as safe as it possibly can be. I've had to also balance outpatient services. So as we've touched on already, you know, the face-to-face versus virtual assessments, there's benefits to both. But we've really tried to sort of revolutionise the services that we have and really try to embrace the changes that we've had to make. And some of those changes have been really positive for us. And probably restarting the preoperative assessment service as well. That's been quite a challenge. We've restarted with a new model of working, and we now actually offer that service on all 3 of our sites, having just opened a new site at Andover very recently as well, which has been really great. So challenges, I guess these are my reflection on challenges. So one of my biggest worries, I guess, was how do I best support and reassure my teams? And sometimes it's not a case of having all the answers to their questions, but sometimes it's actually a case of being there for your team and just being a shoulder and just listening to them. Maintaining the staff's well-being, both for my teams that remained on the ward, but also not forgetting those members of my team that were redeployed elsewhere. Changing our services and specialities based on the need for, you know, the changing picture of COVID, and that picture changed on quite a regular basis. My ward base was historically a short stay day case unit, and then we found ourselves with a higher acuity of patients coming through us, so we had to upskill our staff, which has only been a benefit to us going forward. We had to obviously make sure, as I've touched on, that we provided a COVID secure service for our elective surgical patients, and we did that through ring fencing, working towards restoring services. Pre-assessment has been difficult because that service, you know, stopped completely, and so that's where a lot of our energy and attention has gone into now, because that's ultimately going to be what helps us to help restore our elective program successfully. And, you know, we've all got a real awareness of the growing waiting lists for elective procedures. I know it's very difficult for the patients that are, you know, sat at home that are still waiting for their surgery, and they don't know when it's going to be. I guess the message from us is that, you know, we haven't forgotten you. We're working on a list of priorities at the moment. One of the biggest things, I guess, that would help us during this time is for patients to keep as well as they possibly can. Sometimes patients have missed, you know, routine checkups and appointments for, say, diabetes or you know, high blood pressure. You know, if you're waiting for checkups at this time, you know, make an appointment, go and get yourself checked out, because it helps us massively if our patients are well and fit for surgery when we get to the point of seeing them and giving them a date for their surgery. So if you could pop back one, sorry, Vicky. So the positives, and you know that there's been a lot of positives. As hard as it's been, there's a lot to celebrate as well. So from my perspective, connecting with colleagues that I wouldn't usually work with, you know, I spent quite a lot of time alongside the amazing microbiology team, who I, you know, have done an absolutely awesome job throughout this. We've managed to enhance my ward team's clinical skills, meaning that we now offer a higher acuity service, which means that we can offer you know, fantastic care to some of our more complex patients. We've been able to make, you know, positive and really proactive changes to our services for the benefit of our staff and patients. So looking at virtual clinics, looking at new locations for our services, and also starting to look at some digital systems that would really help us as well. Fantastic camaraderie amongst our teams across the trust, and you know, we've had amazing support from the community as well. You know, even the small things like you know, little knitted mask holders, people coming in with homemade cards, cakes, children sending in pictures. It's all made such a massive difference to us. The picture that you can see there is that's Winchester Army Training Regiment, who actually came in and helped us with some really epic ward moves. And so, as I say, the support we've had is absolutely, you know, awesome. And I guess the biggest positive for me really is that, knowing that we can face any challenge and we can come out of it, stronger than we ever imagined that we could, certainly when the pandemic started. So I guess kind of in line with what Alex said about priorities, this is what's on my radar, I guess, for 2021. Top priority is always keeping our patients and staff safe. And part of that is obviously, looking at the changing picture of COVID and being responsive to those changes as well. Staff wellbeing is always very high on our and my agenda, and we know that COVID as a whole, will leave a legacy from some staff who will have been affected by either, where they've worked, what they've seen, personal experiences. So it's about having the facilities there in place to help support them. Continued service improvement. We've made some really great inroads to some of our services, and from my point of view, I'd like to continue those and not lose any steam in terms of developing those services even further. And the big one, I suppose, that I'm involved with fairly heavily is trying to maximise the capacity for elective operations. We know that we have a lot of people waiting for surgeries at home, and so we're working really hard to look at how we can maximise the number of cases that we can come in and help try and minimise those waiting lists for everyone. Okay, and so the last slide that I'd like to share with you is actually a painting by one of my nurses, Laura Gosh, who might be on this call. Laura, if you are, I'm sorry if I'm going to embarrass you now, but I do so with your knowledge. Laura was one of my nurses who was actually redeployed during the first wave, and she was, found herself caring for COVID patients. And it's fair to say that Laura, found some of the after effects of this really quite tough, and she certainly benefited from some of the additional support that we could put in place as a trust, and hopefully me as a manager as well. One of the things that Laura really engaged in was a bit of art therapy, and as it turns out, Laura's really rather good. So this picture is one of a collection that she's done. Her latest hopefully will be adorning the walls of the treatment centre very soon, but it really depicts the last year in the NHS. And I think, I guess for me, art is quite subjective, but for me, what it really represents is that, even during the darkest and most difficult times, that, amazing people and, acts of kindness can still really shine through beautifully. And that's it from me. Thank you for listening.
Thank you very much, Sarah. That was brilliant. Our final speaker is Natalie Doney, who is one of our clinical care matrons who works in ICU. So I'll hand over to Natalie.
Thank you for that. Hi, I'm Natalie, and I work in Winchester ITU during, the last 16 to 18 months. So normally a HSFT can collectively provide equivalent of 17 ventilated beds. So that would be 13 ventilated beds in Basingstoke and 4 ventilated beds within the ITU at Winchester. But additionally to that, we could provide HCU beds on both sites, and that would be 5 in Basingstoke and 4 here. So during the first wave planning, we were asked to escalate to multiple numbers of beds, but then the realistic number came down to 45 beds. And we provided that with 30 beds at Basingstoke and 15 beds on Winchester site. But to be able to do this, obviously the ITUs on both sites didn't actually have that in their footprint, so we had to escalate out into different areas. So in Basingstoke, we escalated from ICU and HDU, and then on to C2, and then into theatre recovery to amalgamate this, because we had to, within that footprint, keep our green patients, our clean patients, separate from our query patients that we potentially were screening for COVID, and our positive patients. So you had to have 3 different kind of ITUs so that you had the ability to care safely for each patient until they had the appropriate screening and testing in place. And initially, as Anne-Beat was saying, that it took quite a while for that ability. So we had quite a lot of amber patients, quite a lot of, before we were able to get that testing done quicker. And then within Winchester, we were able to have that ability. We had the ITU had 10 beds. We escalated into Wainwright, because it had more side rooms, so that we were able to have more screening areas. And then as our numbers increased and we had more COVID patients, we were increasing into recovery, and we put our long-term COVID patients in there because it was easier to have the rehabable patients that were more awake in one area. So how do we staff this increase in our patients? So in order to care for these patients, we had over 90 staff redeployed to us, and of that 75% were nurses. And during the first wave, we realised during the first wave we did some education to the staff as patients were coming in and as we were planning for that. But then we realised during the first wave, not all the staff that had done the training were redeployed to us. So that training helped support them on the wards, but in ITU, the staff that came to us or were released to us, we had to kind of train on at that time, at that point, as the numbers were increasing. So those staff, they worked exceptionally hard. But during the first wave and the second wave, we developed our critical care academy, the educators on the ward with the managers and our senior management. So what that was is I'm going to talk about in a little bit on the screen slide a little bit on. But the other healthcare professionals we had, HCAs that came to help us, because just having nurses wasn't enough. We needed people to be able to run, to help to roll, to prone people. All of that was different. We had consultants released to us. We had transformation team releasing people to us. We had physios come and work on the unit, ODPs to help intubate the patients as they were needing it. And we had additional supports from multiple medics. The surgeons that weren't operating would come and just be an extra pair of hands on the units. The teamwork was absolutely phenomenal. And we can't actually say, all of that. So there's the picture that you can see where the staff are kind of just setting up in our preparing stage before we had loads of patients. We were trying to, because everyone didn't know what was coming. So staff were anxious, and we tried to maintain everyone's staff well-being and try and keep it relaxed. So that was kind of them setting up the new areas and escalating into different areas. So I basically think our staff that came and throughout all of the areas in the hospital are basically our heroes. They work 12 hours in PPE, and as you can see, the PPE that some of the staff you're wearing is absolutely sweltering. You sometimes had to come out and you have to go and have a shower because you're literally dripping in sweat. But they did that without question. They just did it. Most of the staff, despite whether that was the ICU trained staff or the redeployed staff that came to us, they were all there just willing to come in and do extra shifts without question. We sent out a text, a WhatsApp message, staff needed today, tonight, who can come in for a couple of hours. Staff just came in sometimes in the evening because there wasn't enough staff to relieve the break. So they would come in and just do a couple of hours in the evening, and to make sure that staffing numbers were safe so that staff could go off and go have a quick coffee, but it wouldn't leave the floor depleted because we were having either a run of admissions. And so they would just come in and take over that admission so that the staff could go and have a cup of coffee. But despite everything that we staff saw and did and went through, they did everything with the one job, and they just got on with the job at hand, and that was basically caring for our patients, trying to be as energetic and team supportive as much as we can for everybody, because everyone works so hard. It's unbelievable, and I'm so proud of all the staff that came to us. So I've mentioned before the Critical Care Academy. What was it? So the Critical Care Academy was a 2-week educational program that our educators from both sites on the ICU developed. And it was 1 week where they had classroom and sim-based scenarios for like intubation, what would you do? What would your role be? Simple thing like how to write down the OBS, which we think would be something completely simple that everyone can write down OBS. Yes, on the ward charts they can. Their heart rate, BP, respiratory rate, temperature, but on an ITU chart that's an A3 sheet that's got 24 hours, hundreds of boxes in this line, just the thought of it. Look, the staff just looked at it and oh my God, how am I going to even start to look at this chart? But once you broke it down and you gave them a set of obs on a slide, okay, try and write that down on this practice chart, and you kind of took that fear away of what writing on a chart or looking at a ventilator. Because most people that aren't ITU, when they come in, all they see is, sometimes you don't see the patient that's in the bed, you see the machines that are around it, because you're thinking, oh my God, how am I supposed to look after all of these machines and care and be kind to this patient and look at this patient and do everything that I need to look after them with, as well as all of these machines. And so the academy kind of helped to take that fear away, because the nurses weren't expected to manage the machines. We wanted them to look after the human being that was in that bed space. We wanted them to make sure that they were washed if they were dirty, you know, make sure their eyes and their mouth wasn't full of saliva. Just look after those human needs of that patient, and the ITU nurses would manage all the ITU techie stuff that we're used to doing on a daily basis. But by them having that teaching and saying, okay, we can do that. This is how we're going to do this bit that you can do. You don't have to worry about this. That's my job. It gave them that ability to say, okay, I can. And then as they got more experience, yes, they might say, oh, do you want me to make up that infusion? And then you do it together, because they got the ability to kind of do that. And then on the second week, even though they've been working through the ITU during the first wave, we put them to work with an ITU nurse, so that they had a whole, that week of working with an ITU nurse and knowing the things that they do, that going through their morning routine, the safety checks and all of those things. And then once a month, their wards would release them to come and work on ITU to keep those skills nice and fresh, so that when we were planning to go into the second wave, because we weren't sure at that point if we were going to go into a second wave. So we had that back burner of staff that were additionally trained. One, it was kind of twofold. They took all those additional skills back to the ward where they could recognise a deteriorating patient, because they've had all of that training in place. But also that if we needed to, we had all that skill mix on the floor within the hospital that we could call back if needed. But also, once we'd done all the staff that had been redeployed to us, what we then did was ran additional courses for any wards and staff that were able to be released, so that we could have an increased amount of staff that could come and do that. And in total, we trained 120 nurses, health professionals and ODPs to come and support us if we had any further future waves, which is phenomenal. And every single one of them came back in the second wave. So, okay, our ITU COVID figures. These are just for ITU. ITU at HHT cared for a total of 237 COVID positive patients, which from March to March this year, from March last year to this year. And also in conjunction with that, we also cared for 1,151 non-COVID patients. So just because we had these COVID patients coming through didn't mean that our non-COVID patients just stopped. We still carried on with all of our emergency surgeries that needed to happen, all of the other care that we needed to do, we still continued with that. But also in the back burner had all the COVID patients that the COVID patients came and they stayed for a lot longer than the non-COVID patients in general. Not to say that all of them did, but the majority of our COVID patients could be there. I think the longest of our COVID patients is 4 months and still currently on our unit. And that's, still going, so that some of these patients don't just have short stays, they're there for a long period of time. But also in that time, we have a critical care outreach team who are ITU acute care trained, who then go and see the patients on the ward pre-ITU, post-ITU, and anybody that's got a high acuity that the ward staff are worried about. So they will look at patients and, the staff complete them and they can go down and have just give the staff some reassurance and some guidelines, and if they are really concerned about them, they can come to ITU, because it's a straight talk to the consultant. I need to come and review this patient. I think they need to come to ITU. So, they still saw 2,612 patients. That's astronomical in that period of time, as well as helping out on ITU as and when we needed them to. So looking at the first wave figures, our first COVID patient was admitted to our ITU in Winchester on the 17th of March and in Basingstoke on the 14th of March. And between March and May last year, the ITUs treated a total of 132. And at the first wave, the month where we had the most patients on ITU, of COVID patients on ITU, we treated 43 COVID patients in that 1 month. That was our highest in the first wave. And in that period, the outreach team treated, went to see 1,212, and they stayed and actually treated 519 patients, as well as supporting ITU and going to all the medical emergencies. So in our second wave, our first patient was admitted at the end of September, and on our peak day on January 13, we had a total of 44 patients on that one day in ITU. And we gave mutual aid to a number of ICUs within the country, and the occupancy levels over a period in Winchester was at some points were at 200 to 300%, but that's based on our original level 3 basis, because we were only funded for 4 ventilated patients. So on that point, we were having it between 8 and 12 ventilated patients at any one point. And in Basingstoke, that was for a period of 2 weeks where they were above their normal capacity for ventilated patients. And in that period, the critical care outreach team saw 1,400 patients between December and February. So we cared for a total of 163 patients in this period, and at our peak, that was one day, and then over the month was 78, because as I said, quite a few of our COVID patients stayed for long periods of time. But also we treated a total of 612 non-COVID patients in that same period, September to March period. And 4% of our patients were currently in a hospital at the beginning of this month. I just needed to, I think there's only a few now. So, and also to help support our families, because during that period of time, we didn't allow visiting unless it was for end of life or palliative care. So our family liaison service in Basingstoke had 100 virtual visits, talking to families, which totaled over 39 hours during the second wave, which was something that we learned from the first wave, was putting the virtual visiting in so that they could see their relatives and talk to their relatives if able via virtually. So this is just a wave of our figures from the first and the second wave. So as you can see, the second wave was quite significant rise. So during the second wave, we had some amazing guys and girls come and join us, and I can't thank them enough. They came, so the firemen came and did 2 months, an 8-week stint with us. So the guys in the red on the left-hand side on my screen, they came to Winchester, and on the right-hand side of my screen, the guys in blue, they went to Basingstoke, and they literally, the camaraderie and support that they provided to the team, not just to the team, but to the patients, was absolutely astronomical. They were, like, as I said, they were a breath of fresh air, and they came in and they did as much as they could. Nothing was too much, and they just spoke to patients, helped roles, terms, and did as much as they can. And it just gave us that light relief that of a new person on the floor, and it was amazing, and I can't thank them enough. But also, the one thing I think the whole of the HFT staff, not just ITU, can say is that none of us could have done this without the whole team, whether it's microbiology, even down to the rostering teams, swapping staff around onto our rotas and moving staff to other rotas, and the canteen staff who provided all those free meals. It's not just because ITU and some of the other departments were at the forefront. All those supportive teams, the security, the porters, every single one of them supported us, and it was the whole team working as a team. That is astronomical. The wellbeing trusts in the trust have helped so many of the staff on bad days when they just needed to talk. The chaplains that came up and just sat in the coffee room and had a chat with you. but also all of our generous donations from the community, and these cakes, the chocolate bars, the pizzas that came from, when you've been in full PPE and you come out and you're absolutely sweating and dehydrated, having an extra fridge in the coffee room that was full up with whatever drink was available, and you could quench your thirst and have a slice of cake or a slice of pizza or a chocolate bar, went down an absolute treat. And we couldn't, the scout groups that made those cakes for us, we can't thank enough. There's lots of support from the whole community, and we would just want to say thank you to everybody that supported us and sent us in creams and shower gels so that we could have fresh showers and everything. That's much, much appreciated. So thank you.
Thank you very much, Natalie. So we've now had 3 amazing talks, actually, from 3 amazing speakers. So thank you so much to Av, Sarah and Natalie. There's been lots and lots of lovely comments in the chat, and I can only echo all of them. I'm quite often in awe working with such amazing people. So there are just a couple of questions that we haven't touched on, and thank you to our exec team who have done a lot of furious typing away to answer some of them already. There was one question I just want to pick up on, talking about LFT tests and whether or not they are reliable and what the accuracy rate is. So Av, I don't know if you can pick that up for us to start with.
Yeah, absolutely, happy to. So the lateral flow test that I was mentioning that the government have rolled out as part of their national campaign for members of the public, so ideally trying to get everybody testing themselves twice a week. To anyone who's a nurse or doctor or healthcare worker in the audience, we've obviously been doing our own tests twice a week with lateral flow tests for several months now. The analysis of the data that they use to derive this and use this as one of the tools in the pandemic to help us, they've said that for every 1,000 tests you do, the chance of you having a false positive is less than 1, so less than 1 in 1,000. And it's important to say that the reason they've rolled out these rapid lateral flow tests is that we know that people can have COVID and not have symptoms, and this is a good way, you might, as we do at work, we test ourselves twice a week, not because we think that we have COVID. If we think we have COVID, we have a different test, but this is to just make sure that we're not one of those 1 in 3 people that might be bringing the infection into work. So so for every 1,000 tests, there's less than 1 false positive. Okay.
That's really helpful, thank you. We have another question from one of our governors, Brian. I'm afraid I'm not entirely clear what that references to. I wondered if you could unmute, Brian, and perhaps ask your question.
I think what Brian was saying is when you've trained people to do a job in ICU, how do they then feel about going back to the day job? Don't they want to carry on doing the exciting job? I think that's what Brian was saying.
Yes, sometimes one comes out of experiences like this, absolutely exhausted and absolutely wringing wet with emotion, with everything, and then a couple of days later, you kind of you come off that high, and you're thinking, right, okay, I want some excitement again, and managing that down must be quite an issue for some staff. Complete silence. I've stunned everybody. I can't. I'm going.
I think for some of our staff, they couldn't wait to get back to their normal day jobs because they came, they did the job, and they supported us astronomically. But I've learned a lot, and I've really appreciated it. But thank you and no thank you. I'm quite happy to go back to my patients that can talk to me and all of that. And you know what? Not everybody's an ITU nurse, and not every, just the same as not all of us are ward nurses or gastros or whatever, all of the areas that we have in ITU. But I think that all of our redeployed staff, we tried to support as much as we can. And I think that some of them actually have joined our team and have become permanent members of staff. But I think it's also about supporting staff because not everybody wants to do it. And I think that between the first and second wave, they did their kit days. So, and some people did say, oh, I wish I wasn't where I am now. I wish I'd gone into ITU sooner. But now that they've done it, they're happy that they've done it. So I think everybody's different, and some are, you know, I think quite a few are happy to go back to their normal jobs and their normal roles, because that's the role that they wanted to do.
Thank you very much. Rebecca, you had your hand up. Would you like to unmute yourself?
Yeah, hello. I'm one of the nurses that got redeployed, and I come from ophthalmology, so I thought, what have I got to contribute apart from doing basic nursing care? But I found my experience quite a good experience in many ways, because the team was so supportive. The training was amazing. And my reflection coming back into my own area was it gave me more confidence in dealing with things in stressful situations, because it made me feel if I could cope with this, I could cope with anything. But I also felt that I did contribute towards the nursing care, because ultimately it's about the patient and keeping them safe. And as Natalie mentioned, making sure that their basic care was well covered. And I felt I could do that, but I could add to it with the extra ICU training. So my experience was very positive, and I was just amazed. The whole team just so pulled together, and everybody had something to contribute from their own different backgrounds. So it was just an amazing experience.
Thank you very much, Rebecca. That's really lovely to hear your insights, and well done to the team. We don't have any other questions in the chat at the moment. I'm just going to pause just for a second in case there are any more that come through. Steve, I didn't know if you wanted to add any last reflections as we've heard from our speakers this evening.
Yeah, I wouldn't mind actually. There's a point that Jo made, I think, in the chat about her son who works at Basingstoke, and she says he's shy and won't talk about what COVID has done to his life. If there's anything that can be done through the Wellbeing Hub in support of your son, Jo, let us know. I mean, I know it must be difficult for people, but there are structures there. So if there's anything you think we can do to support you and your son, then please do come forward. I don't know if there's any other questions, Vicky, is there, or should we wind up now?
No, there aren't any others. So I think we will end it there, Steve, if you're happy to close.
So I started this session by thanking all of the brilliant staff at HHFT. So I'm going to finish by just talking about Av and Sarah and Natalie, if they don't mind. You are a credit to yourselves, you're a credit to this trust, you're a credit to the NHS. And Natalie, you used a word in your presentation. You said the word hero, and you three are heroes. Okay, you are better people than I will ever be because of what you've done for this organisation, what you've done for our patients, and you should be absolutely proud of yourselves. And I know there are loads more Natalies and Navs and Sarahs across the organisation, but just for tonight, thank you for everything you've done. You're inspirational, and I don't think anyone who's listened to those talks this evening can be failed to be impressed with what you've done for our patients. So thank you. I hope everyone's enjoyed the talk today. I hope you found that helps understand a bit more what it was like for people. And the one thing I always say about NHS staff is they weren't just dealing with the front line and the jobs they were doing what the rest of us were doing, which is worrying about our families at the same time. And that really struck a chord with me when you said that, because that's the thing I always remind people. It was like doing the job twice almost, wasn't it? So I hope people found that useful. Vicky, I don't know if we've got a date for the next Health Focus event.
Oh, you're testing me. I think our next one will likely be our AGM, which is usually held in July. Okay, so look out. We'll let you know about that. I hope you enjoyed it. Thank you for attending today. And if you've got any feedback you'd like to send us, then please feel free to do so. So thank you for your time, and we'll see you all at the next one. Thank you very much, everybody. We'll end the meeting there.
And thank you for all of us.
Thank you very much, Michael.
Yes, thank you.
Very sorry.